Hey y'all, I'm Dr. Newman at Verity Primary Medicine and Lifestyle in Easley, South Carolina, and this is your virtual meet and greet with myself. I get asked to do meet and greets every so often so people can get a feel of my practice style or maybe about the clinic, and I thought this would be a really efficient way if someone's wanting to learn more about us. Though in another video, I'll be talking about the concept of direct primary care, pros, cons, and if it might be a good fit for you and your family. So I'll link that in another video in the future, but this video is more just talking about my training, interests in medicine and outside, things like that. We'll also talk about the differences between lifestyle medicine, which we incorporate into our practice here, and other types of medicine that it often gets confused with. So about myself, I am Dr. Newman. I have been at Verity for about 2 years at the time of this recording in 2026. I'm originally from North Carolina, so Carolina girl, born and bred. I moved down to the upstate for medical school at BCom and continued living in Greenville for a few years during my family medicine residency training at Prisma Health at Greenville Memorial. And my husband is from the area, and here we are several years later. Really love the upstate and just the Carolinas in general. So a little bit about how I like to practice. Dr. Carnsew and I are both board certified in family medicine as our training goes. So we see infants, we see adults, we see geriatrics. We can do a number of outpatient procedures such as a knee injection or basic dermatology, such as biopsying a funny spot where we want to make sure it's not cancer. You name it, we can do a lot of things. There are certain things out of our scope of practice. I can't take out your gallbladder, but we can get you in the right direction for those instances should you ever need them. Knock on wood, hopefully not. But we can see pretty much anyone in the family, and I actually do see a lot of big families where I'll see the grandma, the daughter of her, their kids. So I'm just seeing a wide variety, the aunt. I take it as a huge compliment if people want to send their family members to me, and I really appreciate those who come. And I feel like I get to learn so much about people and outside of the walls of the clinic or the exam room when I'm seeing multiple members of the family too, which is something I really love about primary care. When I was going into medical school, I knew I wanted to do primary care, whether it was family medicine or pediatrics. And I just knew I found out I loved seeing the whole family from, cradle to grave, as they say. So that's why I went into family medicine specifically. Something that I enjoy about family medicine, I do really love preventative care. Growing up in the South or typical Southern diet and lifestyle, I really thought, wow, there's a lot of things that we can do to at least try to prevent chronic diseases such as high blood pressure, cholesterol, diabetes, things like that, because I would see it out and about every day. And that is actually somehow what led me to being interested in the field of medicine called lifestyle medicine. Dr. Carnsew and I both practice lifestyle medicine. And lifestyle medicine, not everyone knows what it is. It is not functional medicine. It's not integrative medicine. Those are things we get asked a lot, and they are different, though I guess they can use lifestyle medicine concepts as well. But the pillars of lifestyle medicine from the ABLM that we have now are eating a whole food plant-based diet, getting appropriate exercise and physical activity, focusing on restorative sleep, avoiding risky substances, stress management, and social connection. So it's really using those pillars of lifestyle medicine in conjunction with our training from traditional allopathic medicine or osteopathic medicine. A lot of it's overlapping these days to say, okay, I see you have a family history of heart disease. What can we do with your diet, your exercise, your sleep, get you to quit smoking to prevent you from having that risk as much as possible? And if we need to, for the best outcomes 10, 20, 30 years from now, to add medical care and interventions on top of that, then we can do that as well. So it's a good merriment of the two, and I love how in the direct primary care space, that we get more time to do that, because I know I have a lot of wonderful colleagues who are at other hospital systems working for clinics, and they have a huge passion for these things too. It's just a little bit more of a time constraint when you're having 10, 15-minute, maybe 20-minute follow-up appointments with your doctor, whereas here our standard new patient or annual visits are an hour, where we do ask you about, we're going to ask about periods if you're a female and you're not menopausal. We're going to ask you about your sleep. We're going to ask you about how many fruits and veggies you ate yesterday, things like that. So it just opens the window, and everyone's at different stages of their desire to change, and no one's perfect. I'm not perfect, and I talk about this stuff all the time, but how can we take baby steps to get to a better state of health in the future, not only for ourselves, but for our family members, and to live the highest quality of life for the longest amount of time that's possible. So that's something I really love about lifestyle medicine. We're not pushing a bunch of supplements or having you buy a bunch of things. It's really getting down back to the basics, and we have time to do that in the DPC arena in our clinic for the most part, which is really nice. So I hope that was really helpful. If you are interested in learning more about our clinic or about the direct primary care office in general, maybe you're not local to the upstate and you're looking for a DPC closer to home for you, just getting an idea, you can go to DPC Alliance. They actually have a locator, and you can try and find a DPC office near you. If you're interested in any other lifestyle medicine providers, you can also go to the American College of Lifestyle Medicine, see if there's any lifestyle medicine providers near you if you're not local to us. I hope that was helpful, and I hope to see you soon.